You have some time to read the question.
Dr. Hughes, good morning, everyone. Before we begin our ward round, I'd like to briefly review the 3 patients we'll be seeing today. First, Mr. Langford in room 305 is recovering post-operatively from a laparoscopic cholecystectomy. He's doing well overall, though he experienced mild nausea overnight. We've reduced his opioid dosage and switched him to paracetamol to avoid further gastrointestinal upset. Next is Mrs. De Silva in 309, who was admitted yesterday with suspected pneumonia. Her chest X-ray showed a right lower lobe consolidation, and we've started her on intravenous ceftriaxone. Blood cultures were taken prior to starting antibiotics, and we're monitoring her oxygen saturation closely. Lastly, we have Ms. Green in 312, a known diabetic who was admitted with hyperglycemia and dizziness. Her blood glucose levels have stabilized with sliding scale insulin, but her potassium remains slightly elevated, so we've withheld spironolactone for now. We'll also consult endocrinology for further guidance.
Now you have some time to read question number 2.
Good evening. Tonight, I conducted an admission assessment for Mr. Thompson. I introduced myself as Nurse Patel and asked him to confirm his date of birth, which he stated was March 14, 1975. According to the referral notes, he had been experiencing shortness of breath and chest discomfort, which he confirmed. He mentioned that the symptoms worsen with exertion, particularly when walking upstairs, which has become quite difficult for him. When I inquired about any previous episodes, he explained that while he had occasionally felt fatigued, he had never experienced symptoms this severe before. I also asked about any family history of heart disease, and he informed me that his father had suffered a heart attack in his early 50s. I thanked him for the information and explained that we would be conducting some tests to determine the cause of his symptoms.
Mrs. Lewis's knee replacement surgery was successful. For optimal recovery, it's important that she follows a set of post-operative guidelines. She should begin gentle physiotherapy exercises starting tomorrow to help prevent joint stiffness. It's also essential to keep the surgical incision clean and dry. The sutures will be removed in about 2 weeks. To manage post-operative pain, she should take the prescribed analgesics as directed. However, she must avoid any form of overexertion during this early recovery phase. When asked about walking without assistance, I advised that she could begin walking immediately using a walker. As her strength improves, she can transition to using a cane, typically within a few weeks.